I'm Dr. Issac Jhingree, one of the physicians at Elite Care here in League City, where we lived in the Virgin Islands, and then coming over here was just to go to school. But I've been in Texas since 1973. We started in the Houston area. When I migrated over, it was in Deer Park, of all things. Graduated high school in Deer Park. Then I went to Texas Lutheran College. I graduated from medical school in the University of Texas at San Antonio. I started as a chemist, actually. And when I decided to finally go into medicine, the University of Texas in San Antonio was the one that actually catered for the guys who didn't come directly out of college and went straight to medical school. I guess when I was growing up, I just was sort of lost, if you would. I didn't know what I wanted to do really until actually I did some volunteer work at St. Joseph's Hospital there downtown. And it's in the emergency department there. And that's when I realized that this is a very good thing to do. And I thoroughly enjoyed taking care with the hands-on of the patients. I was actually allowed as a volunteer to get hands-on on the patients there. Not to care for them, but to do things like CPR and things like that. It was really cool. So that got me involved very quickly, and I quickly learned that, hey, this is what I like to do. I've been practicing for over 25 years. Unlike all the other physicians here, we're all very seasoned in emergency medicine and are very good at our job. It's interesting because we were some of the original people that came up with the idea of pretty much taking care of the patients in a more of a holistic patient care way, as opposed to running them through the emergency department and just finding out their diagnosis and treating their disease processes and getting them out or admitted. We pretty much thought we should take care of the whole patient here, which is what we strived to do. And some people call it concierge medicine. That's probably a good term. I like it. And that's, we take care of the patient completely. So when I'm not practicing here, I am practicing on the golf course. It gives me great relaxation from the stresses of the ER. I go there and I strive to be as good at golf as I am in medicine. I don't know, I always strive to be the best at what I do. That's the goal. It's not perfection, but it is to be one of the best in what you do. We all care very much about our patients, and I definitely care a lot about the patients that I see in this department here. We get to see a lot less patients than the big ERs, and that's why we can spend so much time. I think there's a genuine satisfaction when you actually take the time out to talk to the patient, get to know the patients in greater detail than just their disease processes. And the patients themselves are completely enamored with the fact that we're actually treating them as not a number, but as a whole person. I think if you ask all the patients that come in there and you interview them, they would say that their experience here is way better than they would at any of the other, EDs in the big hospitals. That's what we try to do. I care.